in a number of areas. So the increase in utilization in Canada is really the staggering statistic that's fueling the job market. And again, back to 1980, it would have been 0.5%, 1990 about 1%, and then through the 90s and the early 2000s, it's the challenge that a lot of chiropractors and physiotherapists have is that the consumer is coming in the front door seeking a massage, and neither of those practitioners is really equipped to do that, specific form of treatment. So I think in the next 10, 15 years, massage therapy is going to continue to grow. More and more opportunities are going to be presented for them, and I can perhaps see a very rosy future where at some point in time, massage therapy gets accepted into OHIP and just becomes a normal part of healthcare and a wellness model. So there's been a huge arc of travel for massage therapists.
So Michael, just to build on that, what are some of the initial steps that people can take if this is their area of interest?
If you're interested and you're an internationally educated healthcare professional, you need to know that massage therapy values your background significantly, especially your background in the sciences, your anatomy, your physiology, your pathology, your neurology. There has been a medicalization of massage therapy, and that certainly wasn't the case back in the 60s, 70s, and 80s, but now massage therapists are expected to study significantly in the sciences. But also your clinical experience and your clinical confidence are really valued in massage therapy. No other medical practitioner in Canada spends more time with their clients than a massage therapist. So those clinical skills and that clinical confidence are hugely important. And you have a huge leg up over basically people that are career transitioning into massage therapy. Most of the students that I meet are career transitioners. They're moving from one profession where it's either shrinking or they've had enough of working on Bay Street, or they just, the promise of their career is not there, and they want to transition into healthcare. So, the fact that as an internationally educated healthcare professional, you need to know that a lot of healthcare professions, not just massage therapy, a lot of healthcare professions value your science background and the clinical experiences that you've had. That's going to facilitate retraining quite easily, quite significantly, in a number of the regulated health practices.
Thank you. Great background on that. Jasmine, you've had a number of questions that have been placed in front of you.
I feel very popular, yes.
Yes, you should feel popular. So if you could just remind the folks again, what the overview is of your organization and why you are so popular with people posing their questions.
Sure. So again, Health First Ontario is a provincially funded agency of the Government of Ontario. Health First Ontario is the health human resource strategy, and what that means is the numbers and the places that our health providers are in places that Ontarians need them. So, in addition to working with internationally educated health professionals, which is a key and core tenet of what we do, it's also about figuring out how we get a better distribution of providers across the province. Those smaller, more remote communities in the north have reasonable access to the care that they need is a key component of what it is that we do. On the internationally educated health professional side of things, we work. We are sort of in the middle. We're not the decision makers when it comes to the positions being allocated or who gets licensed or who doesn't. But what we are able to do is create the space to allow the regulators, for example, to come in and speak directly to the internationally educated health professionals to make sure that the most accurate and up-to-date information is available to our clients. I think that oftentimes you will hear a number of different rumors or innuendo about how a particular system works. We're here to be your guide through it all, an unbiased third party that will give you the best information we can. We have stats on, what a competitive exam score is if you're looking at that kind of information. And where our mandate was always really just to provide information and advice to internationally educated health professionals, because there was a recognition in 2006 among the regulators themselves that clients were getting very confused because multiple organizations were part of this process and they didn't have one central place where they could find all the information. And that's what we do. We've expanded considerably beyond that because we've recognized that language and communication is something that people are needing help with. Alternative careers are something that people are needing help with. Interview skills for the physicians in the room is something that individuals needed help with. We created spaces for the Medical Council of Canada to come and speak directly to the physicians that are applying for positions. To have CARMS, which goes to all of the medical schools in the country to deliver presentations, we said, no, you have to do this for internationally educated health professionals as well, for IMGs, and that happens. Getting the CNO to come in and deliver presentations directly to the IENs. Sorry, the College of Nurses of Ontario. Obviously, the College of Medical Radiation Technologists, pharmacists, et cetera, the list goes on, coming in to get the best information to our clients. That's what we do, and we do it incredibly well. And I say we in the royal sense. There's a group of advisors that are absolutely experts when it comes to the licensing process. And they are the ones that will work one-on-one with the clients and make sure that they have everything they need to make the best decisions for their lives in terms of moving forward in their professional careers.
Can you answer one of the questions that...
Goodness.
Jasmine got a bit of a pile of questions like this, so... Yes.
There's a lot of questions here that are related to medicine, I think. And there's, the overarching question is, why is it so hard? That's a very big question. Just raise your hands if you're an IMG, internationally educated physician. So there's not an insignificant number of you in the room. Medicine has always been a rationed training program in this country. That has always been the case. And residency training positions are essentially the bridging program that internationally educated physicians need to undergo in order to ultimately become licensed to practice in their profession. The province of Ontario funds over 200 of these positions a year and has done so since 2003. That's more than the rest of the country combined. That's an entire other medical school that basically exists for IMG designated positions in the province. And it's also important to note that each of these residency training positions is in excess of about $100,000 a year in terms of what it costs the government to fund them. So there are not infinite numbers of resources available. Medicine has been a competitive profession for as long as I think we can speak of it. It will continue to be an incredibly competitive profession, and a ration system will always exist. That is unfortunately the case. And that is the system within which we are working in currently, and I know that that's incredibly frustrating because significantly more internationally educated physicians are applying for these positions than there are positions available. And we do everything we possibly can to help individuals be prepared to put their best foot forward, but also now to try and help them chart paths that might lead to other things as well.
Such as?
It really depends, and this is the advice I would give to any internationally trained physician that's thinking about an alternative career, is you have to be able to divorce the skills that you've acquired as a physician from the practice of medicine itself. More so than most professions, I know that physicians, their own sort of sense of who they are is very much tied to their profession. And it can be a very traumatic experience to disassociate these two things. And I'm not suggesting it's easy. The physicians that I've met that have been ultimately successful in acquiring alternative careers, be it in research, be it in regulatory affairs, insurance, and some who have actually retrained to become other regulated health professions, have been successful because in part they've been able to mourn the loss of that profession and move forward and put fire in their hearts for something else that they would feel passionate about doing. Not an easy task, not something that can happen overnight, but ultimately if that's the permanent path forward, then that's part of the process.
Very well put. We're now going to hear from Nick DeGroot, who is the Dean of the College of Naturopathy, because I think Nick is going to have some great value to contribute as far as bridging this very point that Jasmine was talking about. And then after Nick, we'll hear from Ruth, from the nurse's perspective.
Yeah, just further to, I mean, in terms of, you know, part of the reason that we entered into offering a bridge stream was the recognition that there were over 7,000 IMGs in Ontario alone that were underemployed, and that you had the skill set that was essentially going to waste in the Canadian context. And so we saw an opportunity, and again, we absolutely value the skill sets that people come in with, and we've compressed our training into a 2-year program that would allow people to essentially practice many of the things at the basic primary care level that attracted people to medicine in the first place. So I think there are opportunities. There's a variety of different approaches that people have in terms of looking at alternative careers. I think from obviously coming from outside the formal sector, you know, healthcare has grown astronomically. There is caps across everything, and I think as far as opportunities to take on more healthcare workers, I think there's a limitation. And so, careers that look at more sort of entrepreneurial approaches or practice outside of that formal healthcare, if you are still wanting to practice some form of medicine, are things that people should consider. Whether it's chiropractic, naturopathic medicine, massage therapy, I think there's a world of opportunity. The one thing about healthcare is there's no cap in terms of the human appetite, as far as I can tell. And I think that's something that people should certainly consider. It's a slightly different mindset. You're not going to go in there and get a salary and get a position in a hospital or whatever. You're going to charge your own way, or you can work within a collaborative care area. But those are things that people need to consider.
For City of Toronto, I got 61 resumes. Out of the 61, I only got one person. Now, when we don't hire somebody who speaks Portuguese, it's not because we don't want them. They don't apply, all right? So please, as one of my colleagues down there said, when you send your resume, you're selling yourself. Sometimes we get thousands of resumes for one job. Unfortunately, with the City of Toronto, we don't accept unsolicited jobs. We have a website. Go into our website every second day. There's new jobs going on there all the time. Go into the website, look at the job call, make sure that your criteria, your skills, experience, and education matches what we're looking for. Submit your resume, okay? If you don't submit it, you can't complain, right? You don't have the right to complain if you haven't submitted it. If you submit it and you don't hear, then you know what, within yourself you can say, I wonder what's wrong with me. But it's not you, it's just that sometimes we get thousands of resumes, and we do go through each and every one of them. I look at every single resume that I get.
So Monica, the question is, if you get someone with no Canadian experience in a non-regulated position, what's your take on it?
Our take is your eligibility to work in Canada. Do you have your social insurance number? Does it start with a 9? Are you entitled to or able to work in the healthcare system? Right? We looked at
Agreed from the hospital side.
Absolutely. Okay. Eligibility to work. It doesn't say Canadian experience. It says eligibility to work. All right.
So I think that's a very important concept
Yeah.
for everyone in the room.
As
to
I
understand.
said, our residents come from and speak 50 different languages and practice 40 different faiths across all of the homes. And we're looking for staff to be able to communicate with these residents, as was earlier stated, to be able to assist with cultural, learning cultural activities. So for us, yeah, for sure, we're looking for you.
Is there?
Even if you don't have the experience, but you do have some certification or degree internationally, that as well we'll also look at, because you need to think about the new graduates that we hire here. They don't have experience either, right? No experience. They just have the certification or the degree. So if you have that, that's enough to turn the spark interest in us.
Does anyone else want to add to that on the panel?
I would say that the one thing I would also add that to Israel's point is that the having even taking a course that's at a sort of a Canadian institution sometimes helps just as a recognition. If it has a co-op program in it, that's got the placement that you're looking for. My informatics guy that I hired in my department, he actually came as a volunteer. And I couldn't believe in a week he developed some database that we still don't even know how to use without him. So it's really about trying to think of other opportunities just to put on the resume. If UT, there can be a research opportunity and you can volunteer there with a professor or you know a professor, then that's something you can put on your resume. So it's just sort of a building block that you're trying to do.
We're getting into close to our summation, so that'll be, your top 2 to 3 tips that you can give to our IEPs in the room. Christina, are you able to table that question? Wahida, do you have another question that has gone?
I think I have just a couple of them. I think we've answered it. I'll be here as long as anybody else wants to stay here. I don't have anywhere else to go tonight. So, and hopefully neither do you. So I'm happy to answer your questions as best as I can. The one question I got, one of them that said, is there a number of employment positions for visible minorities and people with disability? The answer is no. There is no quota. But as my colleagues here on the table mentioned, if you can add some of those those skills and knowledges that you have, so language skills, you put it right at the top. Right at the top under your profile, looking for position, and you say that you can speak Urdu, Gujarati, Arabic, Spanish, whatever that is, that helps. If in the job, if you know that the hospital is situated, or the organization, or the city is serving such a diverse population, give them an example of where you've actually done that kind of work with working with a diverse population. So the answer is no, but understanding who your population is, what that organization is, and who they're serving, if you can answer and help them solve some of their problems, they will hire you. So it's not about quota.
Thank you. Christine?
Yeah, the question here, I'm struggling a little bit, but I think if I got it wrong, come see me. But it looks like you're talking about being overqualified and just job counselors and employers in general struggling with, like, you just have so many qualifications. I've heard of people stripping off their master's degrees off their resumes because they feel like they won't be considered, and that just, it kind of breaks my heart. You work so hard for those and you have to take them off. So I think it kind of harkens back to what someone said earlier. You need to tell us that you are interested in the job that you're applying for. And I assume if you apply, you're interested. And again, to assume otherwise is kind of silly on the part of an employer, but I know employers do it. So what you really need to do is, again, tie it to the posting and express how you have what I need. And that I really want to do that job and this is why. So explain the link between your career path and the job you're seeking, and explain it to us if that's your fear. You're never going to stop all employers from making that assumption, and I think, again, it's very short-sighted, but it's there. But tell us how this fits into your career path, and that should hopefully take a little bit of that stigma off. But please don't leave off your hard-earned degrees. I mean, but again, it breaks my heart. Shouldn't have to do that.
And it happens. John, you want to build on
Just
that?
wanted to add a little point to that, because it doesn't just happen to IEPs. I've actually had that question asked of me in an interview. You seem overqualified for this. So how you respond to this question, should it come across, is what I learned from the sales guys. Every objection is an opportunity. So if somebody says, well, you seem overqualified for this position, your answer is, why is that an issue for you? I'm bringing a high skill set to the table, and I'm interested in this position, and see what they say.
Well, and it's usually the fear that, they're going to be here for 6 months, and then I'm going to be recruiting for this job again. So just say, as part of my career path, this is how it fits in, and explain that if that's what you're worried about.
So treat it like an opportunity.
Yes.
So we could have the two of you table an employment camp.
Actually, just one thing I would say on that. I just actually had a clinical person that had applied for a position, and it was a contract. And I said to her, what is your plan for the next 3 years? And she said, well, I really like to work in a hospital. And then I stood there and I thought, okay, but you need to give me a little bit more, a little direction, a little thing about where your plans are to show that you have some ambition or interest. And my fear in not hiring her was that if she didn't have any career direction, she was just going to stay here for a couple of weeks and leave. So that was my thinking. Her thinking was, if I say anything too narrow, I'm not going to get the job. So it's a bit of a balancing act, but you really want to make sure that you show that you're actually committed, even if it's a contract position. You're saying, I'm really just interested in the opportunity to work here and better understand opportunities and see what other internal opportunities, if you don't have an opportunity for me.
And again, and what another panelist had said, research the organization, and if you can sell to them why this organization is the one you're interested in and why you want to be there, another selling point, along with explaining how it fits into your career path. So those two things together will really help you.